Hello, welcome. This is Bharatraj, CVR English. Today we're going to discuss on the coronavirus outbreak, its impact on world economy. Coronaviruses are a large family of viruses that cause illness ranging from the common cold to more severe diseases as per WHO, World Health Organizations. Coronaviruses are zoonotic, meaning they are transmitted between animals and people. WHO has changed the official name of coronavirus disease to COVID-19, and considered an epidemic as well. As per WHO sources, the first coronavirus outbreak erupted in 2003 in Asia with SARS-CoV virus type, and 774 persons were died because of the deadly disease. The outbreak 2019-2020 seems to be very dangerous and dreaded one. We have an expert, Sudhakar Sharma, to discuss on this coronavirus. Welcome, sir. How are you?
Thank you, and good evening to all the viewers of CVR English.
Good evening, sir.
Nice.
So, sir, the world has witnessed 1720 plague, 1820 cholera outbreak,
Yes.
and 1920 Spanish flu,
Yes.
and 2020 is the now coronavirus. So, what do you think of this, sir?
No, actually, there seems to be a pattern in the nature that sets the standards for such outbreak of the epidemics once in 100 years. As you rightly said, 1720 there was the cholera outbreak which snatched away the lives of so many people. And again we have in 1820 the plague has come, and it too had a death toll ranging to lakhs of people. And again we have the influenza in 1920, and here now again in 2020 we have the coronavirus. Actually there seems to be a pattern, a real pattern which tries to set such a momentum into the nature, because man is here only to protect the nature, but he, in spite of all his education, technology, and with all his achievements in many fields or domains, he is trying to attack the nature. The first and the foremost thing which I believe is man is trying to exploit the nature, and that seems to set the stage for all such outbreaks. We have seen all in the last 300, as you rightly said, starting from 1720, even before it could have been there, but we don't have the record. So such an epidemic or endemic or pandemic is largely due to the man's intervention with the course of the nature. So that sets the thing rolling. So that seems to be the possible reason why this outbreak has taken place, and we can't really attribute it to a particular place, because the outbreak has seen maximum toll. It has started in Wuhan, China, a province in China, and that seems to be the starting point of this particular strain of virus, which belongs to the 7th class, as it is said by the virologists. So whenever we encounter any virus, because they come in large clusters, they never come single or with a short family, they are too clever enough. They are really microscopic in size and nature, and they are very devious and tricky in their strategies. Because if you go with the normal medicine which we administer for the pulmonary respiratory tract diseases, then naturally these viruses get adapted to them very quickly, and they try to take a different shape and course of action, and which makes them really uncontainable.
Is it due to eating habits, or what do you think of
No,
this?
definitely, as you have rightly put it, the eating habit of man has largely been or singularly been the cause of such an epidemic, especially with this type of virus, because as you have said, it is zoonotic.
Yeah.
It spreads from animals to the man. So if an animal is infected with this type of virus, and if a man consumes it, that too, I will tell there are two factors in this. One is consumption of such material without any restriction, that is taking any type of food which they wish to take. And second thing is the method of cooking. Even in the preparation of such dishes also, it needs to be properly cooked, because at such a boiling point most of the viruses cannot survive. That's why the doctors, they prefer a completely cooked food, whether it is veg or non-veg. If it is cooked completely, the body will be in a position to accept it in toto. Otherwise, if it is uncooked, the food will stay in the stomach for some time, give trouble, leads to indigestion, what you call, and some with some little measures it will subside. But in the case of such things, non-veg, it creates real problems because the intestinal tract will be influenced by the microorganisms which come along with that particular food matter which the people take. So what happens is these two factors, the large scale consumption of any type of meat or food, has been the singular cause, I believe, to be the responsible factor for this outbreak in the present scenario.
Sir, presently we are witnessing the outbreak of corona worldwide.
Yes.
So, what could be the possible reasons behind this?
Worldwide, actually, though it started in Wuhan province of China, as we see, the world has become a global village
Yeah,
nowadays.
obviously.
So with so much of transportation facilities, logistics, then with MNCs which are spread out everywhere across the globe, naturally the professionals have to move here and there, because one day morning he will be working in Sydney, the other day he will be working in Mexico, the next day he will be going to his Japan office.
Yeah.
So human life has changed in such a fashion. In such a scenario, such an outbreak of an epidemic, naturally it has the tendency to spread out to the other places very quickly. So that also adds to the much chaos which has come along with this particular type of virus. Especially this COVID this corona is a Spanish word which means the crown. So crown, in the sense, it is the most difficult, illimitable and very tough to tackle with. That is why it is named as corona. These viruses are very tricky by nature and they are really beyond the normal treatment, would not be in a position to arrest their movement or replication, duplication or multiplication. So all these things add to the growth of these particular organisms, and that is why the spread is so fast. Though it started in Wuhan, it has spread to all the other countries. Now so many cases have been reported in Korea. We have seen cases. We have seen some cases even in US also. Some Britain
There are
also.
some
they
cases
reported.
from around 28 cases from India recently.
Yes, actually the most irony is that
Yes,
we
sir.
have cases reported even in India.
And they even seen one positive case in Mindspace.
Yes, really.
They gave orders to work from home, sir.
Really, talking about our own city, Hyderabad, here one case was tested positive because the person has just returned from abroad and he was working with the Mindspace organization or Brightspace. So the organization is temporarily closed because it wants to protect the employees from getting contacted or infected with such virus. So that person has been given the isolation treatment now. He is put in a separate ward and doctors are treating him. Presently his condition also seems to be very stable. The most important thing regarding this type of viral infection is that the patient should never panic, because once you start panicking, your nervous system will become very, very weak and you will be susceptible to any type of infection. So first we have to be morally, physically, mentally very tough. I can conquer this virus. You should have that belief within yourself. That self-belief has to be there. Once you have that belief with you, then naturally you will be in a better position to outwit that particular virus completely from your fold, because that belief has got a miraculous effect upon our system, and aided by the treatment we can really bring about our normal state of health within a very short time. So I advise all the viewers of CVR English news program not to panic at the outset. There is no need to panic because it is also a group of viruses. We have already seen many deadly viruses. So we have seen many bacterial infections also. Bird flu we have seen, swine flu we have seen Ebola virus we have seen.
Yes, sir.
All these things we have witnessed in the world. So these types of bacterial and viral attacks are not new to us.
Yes, sir.
Only what we have to do is to take regular medicine and to be isolated from the normal group and to be really psychologically fit enough to counter and we have to boost up our immunosystem so that any type of such viral attack comes down, subsides within a very short period of time.
Can going vegan also can help in reducing this kind of,
Yeah, definitely,
right? Going
definitely.
vegan is very
Yes.
easy for an individual to do this, right?
Definitely, definitely. That's one type of one thing which we can do at this point of time to counter such things, outbreaks.
And one more doubt, sir. See, what are the symptoms of this virus, and how an individual will come to know that I am with
Yeah,
this,
definitely.
I'm affected by coronavirus?
This is quite an interesting question which you have posed to me because it is the need of the hour also.
Because most of the in India, there are, if the people are below BPL, below
Yes,
poverty line, or the people
yes,
who are traveling, they don't often go to doctor because
Yes.
they charge a bomb on them.
Yes.
So they will just do home remedies.
Yes.
Going directly to a medical shop person doesn't know he is infected with the
Definitely.
virus.
Definitely.
So how will an individual come to know he's infected with this disease?
Yeah, this is something like this. Actually, any virus, first it inflates our system by increasing the temperature. First, we will have a kind of temperature rise, which is commonly seen with all viruses.
Yeah.
And along with the temperature rise, you will have problems with your breathing initially. You will have common cold or some roughness of the throat. Some such systems will come. These are common to all types of viruses.
Yeah.
But with this particular type of coronavirus, what happens is that it will make a deep root within our respiratory tract. So it tries to change its place very frequently so that any treatment is not possible to arrest its movement
Yes.
or growth. So that way it captures the entire system slowly and it passes on to the renal system also. It blocks the renal system completely, out and out. So when man is out of control with his lungs and the renal system, because there will really be, he will be fast approaching his end. His end is, it becomes inevitable in a way. That's why these viruses are considered to be very fatal in nature. But by taking regular medicine in the certified hospitals, our government hospitals are also equipped with the state of the art technology. So if you can go to such places, take the necessary treatment, then naturally what happens is the person will have the immunosystem getting developed day by day. Then slowly the virus also will start depleting in its size and shape, and slowly it will be taken out of our body also, completely. So cure is possible, but person should not panic.
Okay.
That is the most important thing. And because of the isolation and all the other things, naturally he will be put to some kind of inconvenience, isn't it? Because he is isolated from his family, from his friends, from the world, from everyone. So naturally what happens? He will develop a kind of gloom within himself that something has really happened to him. And one more thing which I would like to say in this context is, first of all, this is the seasonal change is going on. Now winter is going and summer is fast approaching. So in between this transient time, there is a likelihood of getting common cold and fever and body pains and all such things for everyone. So everyone should not think that just because he has cold and fever, he should not believe that he is also getting infected with coronavirus.
Exactly.
That is a myth actually, because coronavirus, that infection is totally different. Normal cough and cold, they will subside in 3 days.
Yes,
But
sir.
this will persist for a long time and the pain will be there. Suddenly there will be shortness of breath and many problems will be there associated with it.
Cough, running nose,
Cough,
sneezing.
running, yes, and entire body becomes very supple because of the presence of the deadly virus. So that is totally a
I also
different
read
aspect.
that there is shortness of breath.
Definitely, because of the respiratory tract being under the control of the virus, man cannot breathe easily or as he does normally. So that tells upon his health. Naturally, that too, with so much of technology, whatever is happening digitally, whatever is happening at every nook and corner of the world is being known to everyone. And with that update also patient feels when so much of death and other things toll is rising day by day, he feels that he is also fast becoming a victim of the same thing. So that type of tendency also has to be reduced.
Okay.
He needs to be, apart from the medicine, what I would suggest is he should be given psychological counseling, which is very effective, because psychological counseling adds to the moral fiber of the person. That is very important, because once if you are morally strong enough, you can conquer everything. That should be instilled in the person. Even the people who are being treated in China and other places are also being given this type of counseling. Do not panic, because whatever stage of the viral attack you are at, if the end is nearby, nothing can be done. But all the suspected need not die.
Yes, sir.
The thing is, if it is really fatal, nothing can be done about it.
Yes.
But for those who are just infected or about to be infected, for such people, there need not be such tendency that they would also join hands with the other people who have passed away.
Yes, sir.
So it is like that, ma. So both paramedical treatment and medical treatment has to be there, and apart from that, psychological counseling is a must for everyone.
Sir, before going to the next question, I'll go for the small brief.
Very nice.
The coronavirus is first identified in Wuhan in China, and first case was reported in December 1st, 2019. As of 2nd March 2020, more than 90,000 cases have been confirmed, of which 88,000 were classified as serious. Around 3,000 people have died in mainland China, and about 175 have died in other countries, and more than 45,000 people have recovered. How fast the virus spread in India? Initially, people and governments were in wrong assumption that coronavirus is limited to China, Taiwan and South Korea. The virus spreads across other countries like bushfire. More than 72 countries and territories have been affected, with major outbreaks in China, South Korea, Italy and Iran. Coming to India, first case on coronavirus was reported in Kerala on 30 January. Its first case was confirmed in a student who had returned from Wuhan University to Kerala. On 2nd February, a second case was confirmed in Kerala. The individual traveled regularly between India and China. On 3rd February, the third positive case was reported in Kerala. The patient had traveled from Wuhan. All three have since recovered from infection. Later on 2nd March, the Health Ministry reported two more confirmed cases, a person in Delhi who had traveled back from Italy, and an individual in Hyderabad who had travel history with the United Arab Emirates. In addition, an Italian citizen in Jaipur who was earlier tested negative was tested positive for coronavirus, totaling 6 confirmed cases in the country. 80 people who were in contact with the Hyderabad individual, including fellow bus passenger from Bangalore, were tracked down by the government and placed under watch. 15 crew members of the Air India flight, which had carried Delhi individual from Vienna, were placed in isolation for 14 days. Sir, all these cases you have been observing.
Yes.
I think it's 28 today.
28 today. Actually they told the number 28 is a matter of real concern for each one of us.
Yes, sir.
Because once the corona outbreaks here, naturally it might rise to a little higher also. So all steps need to be taken, much more awareness need to be given to every individual, so that the toll need not rise beyond this. Here, regarding the 28 also, most of them are the Italian origin. Then the other people are identified, 3 in Kerala, 1 in Telangana. So the Telangana person also, he has just returned from abroad and he was tested positive for the corona.
Yes, sir.
And he has been allotted a separate ward.
Yes.
Where the treatment is being given to him. So all these things, what do they speak to us? They really give a message. Whenever an outbreak of an epidemic is there, an epidemic comes with a message. An epidemic comes with a warning.
Everything came with 100 years of
Yes.
period, sir.
Because man said to himself is not in a position to utilize the glorious resources which nature provides to himself or herself. Man, in his over greed, he has become a slave to his wishful thinking. So what he does, he tries to get over the limits of the nature. Once he crosses the limits, naturally he welcomes such epidemics. We have seen mighty oceans, but they never cross the beach and come into the cities. They have a barrier. They follow that. In the nature, everything has got a barrier, a kind of restriction within which it operates.
Yes.
But only man, though he is endowed with the intellect and though he is called the pinnacle of the creation, he does not obey or try to understand the true spirit of the working of the process of the nature as such. So he naturally tries to transgress all the rules. Believing himself to be very intelligent, he tries to overcome all the rules and all the limitations which nature imposes rightfully upon him and tries to disturb the nature as such. By this, he is not only damaging the humanity at large but also causing the same trouble to all the animal species also.
Can we think that is it a message from the nature? Is it a warning to human beings?
Definitely, as I have already told you, every epidemic is a signal, is a warning, is a message to the entire humanity, because mankind has to obey the rules of nature. It has to abide by the rules of the nature. It has to contain its wrong tendencies to exploit the nature. We cannot exploit the nature. We have to befriend the nature. Nature is here to help us. We have to use the resources in a very friendly manner. We cannot outright go and conquer it. Any tendency to conquer it or outbreak the rules will certainly invite such catastrophe as we are seeing, because so many, now all the countries of the world are united by this technology. The whole world you can travel very easily from any point to any point. And students are also getting educated in different universities of the world, trade, commerce, business, professions, so sports, all these things. They try to bring people from one part of the world to the other part very easily. International conferences are there, international associational meetings are there, international congresses are there, then sports meets are there. So many other things will bring people from one part of the globe to the other. When at such a time such an epidemic outbreaks, naturally it's a warning not only to the Wuhan province of China but to the whole world at large.
What is the impact of this? What is the impact of this virus
Yeah,
on an economy of a country?
definitely. When we speak about the economy of China, naturally they were on the rise. They were in a upbeat mode before the outbreak of this epidemic.
Yes.
But now, so with so much of man force and with so much of other amenities getting really reduced, and with so much of this, it's a kind of blackout for them completely. So all their economic performance has come down drastically. So this also speaks really, it's a kind of it's a disaster for Chinese economy, and for those countries which are dependent on China either for the import or for the export, because business does not go in a linear way. It has to be clubbed with other countries. They do commerce with so many countries of the world. So naturally the partners in commerce will definitely be affected.
And even the summits have been postponed,
Yeah,
right?
definitely the Asian summits and
Postponed.
other meets have been postponed, because the concern is such that it has become everyone is facing that grim nature of that corona, that deadly corona is giving a real concern to each and every individual on this planet, because it can attack anybody.
Yeah.
Being zoonotic, it spreads fast, and from man to man also. Just by the mere touch or by mere, if you come real close to him, it can come through vapor also. Handshake. So that's why in our Indian culture, as you can see, we never greet a person through handshake. It has been the custom in the Ayurveda.
Namaste, sir.
We
You can
only
go for
say
namaste.
namaste.
Yeah, that will
because
be the better for this
yeah,
season.
that's better, because centuries back our Ayurvedic physicians have discovered that some germs inhere on the surface of the skin. So when we give shake hand to somebody, naturally the germs will pass from one hand to the other.
Of course.
So to contain that, they say namaste. So that's the glory of our tradition also, and it speaks volumes about the glory of our Ayurveda also.
In Japan, they will bend for each
Yeah,
other.
definitely. Our Asian countries have got the different way of saluting or greeting others, whereas this handshake is a Western concept,
Yeah.
where they shake hands directly. that is the primary source of transferring all our infection to the other or receiving the same from one to the other. So this has to be avoided at least for some time. Then personal contact with in a very big group or get-togethers under AC for a long time in recreations or for any other thing is not advisable at this point of time, because there people from all varieties, backgrounds and all types of this one, they will mingle together, so we cannot discriminate between them. So such get-togethers have to be abandoned for some time. We have to keep distance from long travels also, from airlines. We cannot use our airline service also for quite some time.
Yes.
Even the major airlines like Emirates, they have stopped the airline operations for one entire month. Complete entire month, entire staff has been given a paid allowance also for them. So major airlines. So as we were speaking about the impact on the national and international scenario, apart from the direct commercial contacts or other commercial businesses, we have this airline and other telecommunication and so many other things getting hampered because of this outbreak. And so many offices are also getting closed because the companies or the organizations or the MNCs do not want to give any risk to their employees under the policy which is set by the WHO. We cannot risk anybody when such an epidemic are. Now this has become really a pandemic, because outbreak is seen not only in Wuhan or China or the other provinces of China or the surrounding countries, but it is spread everywhere now. Because of this global trafficking or the human trafficking, it is spread everywhere. So I don't think if WHO makes it a pandemic also, we need not be surprised in a very short period of time, because it is spreading everywhere like that.
And going for the next question, sir, is there any effective measures that is available in India, Indian medical system?
Definitely, it's an interesting thing to be discussed, to be understood, because our Indian system of medicine is largely Ayurveda. Ayurveda is an offshoot of Veda which tries to attack the root of the problem. While the Western concept is only peripheral or surface scratching, Ayurvedic treatment goes to the very root and solves the problem. It wipes out completely. So here also we have so many methods and medications available in Ayurveda as well as Siddha system, which is an offshoot of Ayurveda only, which is being largely practiced in Tamil Nadu and Kerala. So with these medicines, parallelly with the allopathic drugs, what we can do is to develop the immune system of the individual, so that if the individual is immune and if he is really strong enough to counter the attack of the virus, he will be in a much better position than the person who falls prey to it. So that way the Kaya Kalpa of the Siddha system and our own Ayurvedic system, they really help everyone to increase. And as you can see, the Ayurvedic medicines are not costly like the other drugs. We have the famous sacred Tulasi water. Tulasi is present in the house of everybody.
Mustard powder.
Mustard powder is there, turmeric, so many other things are there. The things which are easily available to us in our own kitchens. So using those things and taking warm water. Everyone has to take warm water at least 5 liters per day. Because the more and more intake is there is a chance to drain out all the toxic material from our body. So we have to take at least 5 liters of
we can also give that immediate hand washing immediately.
Definitely, that's yes, it's an interesting thing which you have said.
Or some alcohol based soaps are there.
Yes, we have to occasionally wash our hands.
They can avoid hand shaking.
Yes, we have to completely abandon it.
Yeah.
At least for some time. Handshake has to be abandoned. Then hand wash has to be really made mandatory. Every time we go for a meal or even after every 1 hour or 2 hours, we have to wash our hands.
You can also mention this use of face masks.
Definitely. Yes. I forgot to mention it, because face masking is really very useful in driving away 70% of the viral attack. 70% we can avoid it. But if the virus is really determined, it can penetrate even through the small pores of that mask and it can enter our system. But to 70%, we are sure enough that it is driven away from us. So that way, mask is a must for all the students at least. And one more thing in this context which I would like to tell is that the mortality rate with this type of viruses, which is given by the Virology Institute of Pune, is that those people who are above the age of 60 are more susceptible.
That's
for
because
this.
less immunity power,
Yes,
right?
because
The more,
naturally their entire system is worn out. They have got very less power
Less
of
immunity power.
less immunity power is there. WBC count will be less.
Yeah.
So all these things add to their fatality. So that's why those who are 60 plus and those who are infants and neonatals,
So the
they
count
have to
will
take
be
care.
going the same in China as well, I guess. Mostly
Yeah.
the old age people are.
Definitely, China actually has a majority of the Chinese people are above 60 only. So it really has a deeper impact, and we sympathize with from the bottom of our heart
Of course, sir.
for the people of China,
Yeah, definitely.
because they are our neighbors, and when such an epidemic strikes in their place, we naturally feel sympathetic, because
Definitely.
the Indian mind is sympathetic with
Definitely.
everyone, wherever, whether it is in South Africa or South America or China or Bhutan. Whenever some trouble is there, Indian mind immediately reacts, because it is endowed with that power of empathy. So naturally, we as Indians feel a lot for the Chinese, and our Indian government has given a lot of medical equipment, then medical accessories we have sent through our special air force.
Airways.
Our big planes have carried all these things to them, and we help them in deporting the people also, because other neighboring countries like Nepal, Bhutan, they have requested the government of India to bring back their people who are stuck up at China. So all this, we have our Indian army is doing a wonderful job. They are risking their lives. They are carrying the life-saving messages, masks and other eatables which are required for the people over there, medicines and all these things. At the same time, they are bringing people back to their own countries who are stuck there because of this epidemic, because so many airlines are really cancelled, and the government of China has made very strict restrictions regarding the mobility of the people's passengers also. And once here also, if any passengers return from any country, our government of India has made it mandatory for everyone to get thermal screening also, to identify if there is any strain of virus sticking to him, and they have been kept in quarantine for some time. Only later they are allowed to mingle with their respective families.
Sir, the cases which arrived in Hyderabad
Yes.
or other states, they have not been checked.
Yeah.
So the officials, what they thought is only the people who are coming from China,
Yes.
only they have been checked.
Yes.
So that might be the mistake. What do you think? Is
Yeah.
it that, or that cannot be scrutinized?
No, actually, what is happening is, presently the virus is more prevalent in China. So we suspect people who are directly in contact with that particular place as such. It could break from any place. But since its eruption is identified with China, we actually suspect the incoming and outgoing from China and its associated people. Nowadays, Hong Kong, Korea, they are thickly connected with China. So they too have registered massive growth in the number of the corona cases. And we have seen some people from Iran also, they are reporting that some such symptoms are taking place among the citizens of their own country. So all these things speak volumes. We have to really scrutinize them thoroughly, whether it is due to the contact or from the return of a foreign country or here itself. Every person who is having a fever or cough or the respiratory problem for a sustained period, protracted period, he should be diagnosed under special methods. PCR test, which is presently present to, which is trying to test whether a person is positive or not. That also helps in gaining all these things. So we have to take all the measures possible to really identify the person who is really affected with this type of virus, and then give separate treatment, provide them treatment, in-depth treatment to them separately, so that it should not multiply and it should not spread to the other people, because fortunately the cases are very low. So that all these things have to be taken into consideration. So these are some of the measures which we need to take, and all these things add up to the security issues and other safeguarding measures of this particular type of corona outbreak. So, as you rightly said, presently the presently we are checking people who are coming from abroad, but a scanner has to be there upon the people, the residents also, so that such an outbreak is not seen and not replicated.
Sir, we'll go for another brief of the
Definitely,
coronavirus, sir. 2 minutes.
that will update it.
Yes, sir.
Definitely, that update helps us.
What are the symptoms to find coronavirus and preventions? Among the other states, Telangana responded quickly on coronavirus and took necessary steps for treatment. The government increased the separate beds for the corona suspects in NIIMS, Gandhi and Osmania hospitals. Telangana Health Minister Rajendra said government deployed medical crew in Rajiv Gandhi International Airport for tests to confirm whether passengers got virus or not. Common signs of infection include respiratory symptoms, fever, cough, shortness of breath, and breathing difficulties. In more severe cases, infections can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Economy impact. Corona showed negative impact on global economy. $7 trillion evaporated in different nations within last 10 days. Tourism is the first sector affected in all nations. US postponed Asian summit which is scheduled to be held in April this year. Corona is forced to postpone Summer Olympics Tokyo next year. Sir, all these postpones, the economy,
Definitely.
everything is playing a the corona is playing a pivotal role in destroying everything.
Definitely, because corona, the impact of corona has become really global.
Sir.
Because it has far-reaching effects. The outbreak has really arrested the movement of the people first, because the human element is getting stranded. The second thing is any deal with China is, for the time being, it's completely washed out. And other things are, Chinese goods are being imported largely worldwide. So that also hampers the growth and commerce between all these countries. Again, the Chinese manpower, which is really predominant everywhere, are really under the fear of this dreaded corona. All these factors really add up to the what do you call the catastrophe of this corona.
And what could be what are the psychological effects if the people are undergoing this
Definitely.
virus?
Yeah, this is the most important aspect which everyone has to understand, because whenever an epidemic strikes, apart from the treatment, the most important thing is psychological well-being of the person is more important than the physical well-being. Because once you are psychologically down, then any amount of treatment given to you would simply go in vain. It does not have any effect. So whatever we do is to completely, an integrated treatment has to be given both to the body, to all the systems of the body, and also to the mind of the person. It should be strengthened. It should be made very clear that coronavirus could be tackled.
Yeah.
We can tackle the coronavirus provided the person does not panic, and if he is brought to the notice or the care of the doctors, professional doctors, in time. So all the pulmonary specialists, they are in a position, they are working out by various methods to control this virus. So certainly it could be arrested, and most important thing is death could be prevented.
And what could you suggest our citizens mostly on to get away from these infections or virus? I'm thinking the pivotal or primary is eating habits
Definitely.
and hand washing, what we
Definitely, yes.
lastly
Yes,
discussed.
yes.
And what more other points what you can add on?
Now, these two things are so very important, that first thing is one has to be really contained within oneself. He should not be a slave to his wishes. First, he should start respecting nature. Nature has been here only for our aid and our complete growth. It should be befriended and it should not be acted against. So that golden rule should always be kept in the mind of every single individual in this country, especially our people here in Telangana also have to bear in mind that we should never cross our own limits, whether it is in eating or moving out or doing anything extracurricular. We have to act within the limits. That is the golden rule. Hitam mitam, they say. So whatever is hitam is mitam. Mitam means within the limits. That golden rule has to be followed. Then avoiding handshake completely and washing our body. We have to, it is preferable for everyone to take bath at least twice a day now. During this period at least, for some time they have to take bath twice a day. And the most important thing is here in Hyderabad, as the temperatures shoot up, it will be a good news for all of us. Because
viruses who don't
viruses
live.
will not be in a position to live. They cannot last at the temperature. They will naturally be away from such place.
Yeah.
Only they will be attracted to moist conditions. So with the little winter effect left in Hyderabad, we only hope that we will be very clear and we will be free from this effect of the corona within a very short period of time. And meanwhile, we have to take food which is completely cooked, and hot meal is preferable. Hot and semi-hot water, that is warm water, we have to take along with tulasi leaves.
And also one more point, not to
Yeah.
take stagnated food.
Yes, never to touch stagnated food, at least during this crisis time.
The people, most of the people, they will put in the refrigerators.
No,
they
that's
leave
bad.
in the morning.
That's bad.
For this period at
Yes,
least,
at
they
least
have to avoid
during,
that kind of food,
during
right?
these times, hard times, we have to forego such things. We have to prepare the food, then consume it within 6 hours.
Yes.
Anything beyond 6 hours will become toxic, and it is liable for all such viral attacks and bacterial infections. So we have to take the completely cooked food, that too within 6 hours. We have to always take warm water, that too 5 liters, not less than 5 liters per day. That has to be maintained. Then body wash, twice or thrice is also recommended. Then hand wash every 1 hour. And mask, wearing a mask is a must. If mask is not available, one can have handkerchief. We can protect ourselves through handkerchief.
They can
also.
make some cotton cloth.
Definitely,
tie it.
definitely. If mask is not available, we have to go for some
Even
such
cotton cloths
alternative.
are good, sir.
Yes, definitely. Anything which can protect our nose and mouth, that is a welcome thing. Then the thing is, we have to avoid all get-togethers, at least for some time. Public meeting. Then gathering in large numbers, staying in enclosed AC halls for a long time really is good for containing this type of coronavirus. Not only corona, any type of such a epidemic. All these measures have to be taken, and if all such measures are followed strictly and in tandem with the rules which are set by the WHO, naturally we would be out of this crisis very soon, and we can all really cherish that time when this corona outbreak is completely vanquished from this earth forever.
Nice, sir.
Okay.
And see, the people who are educated,
Yeah.
they'll be knowing what's corona,
Yes.
what are the viruses.
Good.
And the people who are the families, working class, or the people who don't have any knowledge,
Yes.
ones who only uses their body in their work,
Yes.
they don't. I'm not degrading them
Yes,
that
yes.
they don't
No,
have.
no. They will not have the opportunity to know all these
Yeah.
things. You are
So
telling.
who is that person or an individual who is going to guide them?
Yeah, actually.
There is no chance that we will be watching our channel or
Yes.
any other channel
Yes.
to get knowledge on
Yes,
that.
yes.
So who are that person? Who are the volunteers who gonna?
Definitely. What you have raised is really the need of the hour, because all the educated people should volunteer themselves.
Exactly.
At this period of time, they have to take this awareness, spread this awareness amongst the people, the commoners first, because we should go to them. We should go to them, give this awareness, we should train them how to live so that such a deadly corona will not affect them and they be safe from such deadly effects. So volunteering is very important. All the educated people and school children who are in the higher classes, they have to form a team, go to their respective colonies and they have to inform all those who do not have the opportunity of getting all this learning or awareness from channels or books or through any other media. So we have to guide them personally. We have to tell them such an epidemic is there. You cannot do all these things which you were doing before. So such guidance has to be given to everyone. That will really help them a lot. Volunteering is really very help. Then we have to conduct workshops, then we have to conduct seminars, then we have to conduct people in such a way that they be safe and away from this type of epidemic. So all these measures we have to take now and then, because already one case is tested positive in Telangana.
Exactly.
So when such is the case, we have to really work
It's
hard.
from Mindspace they
Yes.
evacuated the place.
One of its employees who
Yeah.
just returned from an assignment from abroad was having some such symptoms, and when tested he was positive.
Positive.
So the alarm has spread everywhere. Now the media is also giving a lot of coverage on this particular aspect, because any contact with such a person might result in the replication or the intensification of such a thing in the case of the others also. That's why he has been screened, kept aloof, and he has been treated in a separate ward in our government hospitals, where our modern medicine is being administered by our doctors. So our government hospitals are really having the latest technology, so they are doing a wonderful job. We thank all the doctors who are behind this, and also the doctors of WHO and the doctors of Wuhan province, who have really risked their lives to save the life of another person. So the medicos who have really volunteered to die to save the others. Our CVR channel, on behalf of our channel,
Definitely.
we really remember all those great souls, because knowingly that something fatal would happen to them, they ventured forth. They did not care for them. They only tried to suppress that virus. They only tried to remove suffering from others, and in the process they had to give up their own body. So blessed are they, because they went in the service of the others. So all the medicos are doing wonderful things. Apart from those, we have the paramedical help is there. Then we have so many, our Air Force is doing wonderful service, taking medicines, then deporting, all these things, wonderful jobs our Air Force is doing. Then apart from that, as you said, our ministers and other political giants, they are also working hard day and night to control this kind of
Even
corona.
the people who are experiencing these symptoms,
Yes.
because the officials or whatever the people who are working on it, they can't scan the people.
Definitely.
It's the first fundamental duty is an individual who have
Yeah.
to come forward to explain,
Definitely.
yes, I'm having these symptoms, could you please check?
Really.
So that could be one good thing.
Yes, this also happens to be a critical factor with
Yeah.
respect to coronavirus, because generally we have the tendency to take things very lightly.
Yeah.
We have running nose or cough
Yeah.
or anything, we don't take it seriously.
If you're feeling the chest pain in
Yes,
chest,
chest pain also, or shortness of breath also,
Anything.
we try to actually
Ignore
attribute-
it.
Yes,
it's a small thing, nothing is gonna happen.
Yes, either ignore it or attribute it to something else,
Yeah.
but not to this particular issue at hand. So that way also the risk could be really large. So what we have to do is, if any such symptom is persisting beyond a certain time frame, then naturally we have to take that person, or if it is affecting us, we have to approach the doctor who is nearest to us. Then we have to tell him what problems we are really encountering, whether pain is there, acute shortness of breath is there, or renal difficulties are there, or irritation of the eyes is there. We have to clearly tell our symptoms to them. Only then the doctors will be in a position, they are in a better position to judge, weigh, analyze, and try and come to some kind of understanding regarding the state of our own health. So I request everyone not to neglect the symptoms which we have mentioned earlier, like mild fever to heavy fever, high temperatures, or cough, running nose, and throat roughness, and repeated cough and other bodily symptoms. If they are present within you or anybody, definitely guide them to the nearest medical school or hospital, or to the professional and let that person be screened by the doctor, cared by the doctor, and treated by the doctor. That is our advice.
And one more thing, sir. Thing is, during this period,
Yes.
the government also could give some orders to small clinics that not to charge
Yes,
fee on basic checkup.
Yeah, this is something humanitarian.
So the people
really.
can show some interest to check them.
Yes,
If
excellent.
they found any symptoms of any cough or sneeze, they can go to the doctor without any fear or.
Yeah, this is something
This can-
really humanitarian because
Exactly.
when such an epidemic breaks, the clinics or the private practitioners or the corporate hospitals should treat them with all kindness.
This could
but
not
should
be a lifetime.
Yes,
Only a period of time.
Only
Only a
during-
period of
at
time.
least within this
Yeah.
span of time, they have to apply humanitarian methods and not corporate techniques.
It's
and
not only
strategies.
for that individual. It's also for the nation. The
Naturally,
greatness of for the goodness
yes,
of the nation.
it is for the entire humanity.
Exactly.
Because life is life. Whether yours or mine or anybody's, life is precious.
Yeah.
Life is God given. So we have to respect the life of every person or any person. So that way, what the point which you have made is really very apt with the present situation. We make a request on behalf of this channel to all the corporate institutions, medical institutions, to treat the patients voluntarily with all kindness.
Exactly.
At least for this particular, during this time of this epidemic, because it largely tells upon the effect will be great.
Yes, sir.
Then people also, without any kind of inhibition, they can come to the hospital.
They'll directly go to the hospital
Yes,
and check
definitely.
it, sir.
Because of the skyrocketing or the rates which are quite absorbent.
Because
the people
there,
are really
there are some
scared.
hospitals, sir. In one clinic, it would be 100 rupees for
Yes.
going in, the basic fee.
Yes, yes.
So in one hospital, it might be 50.
It might be.
There are people who are thinking to go for that least cost also.
Definitely, because
So if they exempt this fee system for a period of time until this virus calms down,
yes,
that would be a good thing.
yes, really, it's a wonderful thing because it really helps so many people.
Yeah.
If one person is saved, and the entire family which is depending on that person is saved.
Yeah.
So saving one person is like saving 5 people who
Yeah.
are dependent on him. Like that, if you see the humanitarian help or grace which the corporate institutions, if they can give here, it really tells upon.
And
It
also
is
one more
really-
idea, sir. They can also implement mobile clinics, small
Definitely, yeah.
clinics going on the road.
Because we all the while we have been thinking only about big towns
Because
and the
there are some of the
metros.
people, they don't have any clinics nearby.
Yes.
They might be ignoring again.
Because
So the mobile
most,
clinics can help them.
Definitely, it's
They
a
feel,
wonderful,
right?
wonderful idea because
sir.
most of our brothers and sisters,
Yeah.
they are locked up in remote villages and remote areas where medical facilities are not available.
Yes.
So we have to send some mobile equipment, mobile medicine, mobile treatment cans or mobile treatment wagons to such areas where the treatment is given to them free of cost.
Exactly.
Actually, the Ayurvedic medicine or the Siddha medicine is given free of cost by the practitioners. We cannot ask allopathy doctors to give free of cost, but at least they can reduce it, they can give a very big concession because it's an epidemic of a very large scale and people from all parts of the world are really getting scared. So the entire medical fraternity has to come together to aid, save, treat the patients. So nice point you have made.
Yeah, thank you, sir. And we'll conclude this show with this,
Oh.
all these fantastic points. Please give that important points, sir, before leaving the show. All those
Yeah.
important points about washing your hands, through
Definitely.
your words,
Yeah.
washing the hands and the namaste,
Namaste.
not to
Not to
avoid the
handshake.
shake hands for a
Yes.
few more days.
Yes.
And some more points you mentioned, sir. Please, I just want to.
Yeah, just before
Give them to
concluding
our
our
viewers.
show on corona, let
Yeah.
us try to recapitulate the important points which are required as
Yeah.
precautionary measures by everyone. At least during this part of time or within this span of time, we have to completely abandon handshake and we have to wash our hands regularly, every hour possibly, with the solution.
Alcoholic solutions, sir.
Yeah, definitely we have to use the solution because it wipes away most of the virus and most of the things viruses, they inhere on the surface of the body. So complete body wash twice or thrice is also advisable during this period. Then the most important thing is to go for vegetarian food,
Yeah.
only veg food. And if non-veg needs to be taken, it needs to be cooked completely and should be taken within 6 hours of its preparation. If it goes beyond the time of 6 hours, it becomes stale, and all toxic things, bacterial infections, viruses will crop up there, and they directly enter into your system. So we have to avoid all those things. Then we have to avoid get-togethers in enclosed AC theaters or enclosed AC conclaves.
Yes. If it is,
At
they
least
have to
for-
carry their own mask.
Definitely.
If there is any chance, they have to give a free mask with the ticket.
If possible, we can donate a mask to our brothers and sisters.
Definitely.
That will be a great service. If mask is not there, at least we have to use our handkerchiefs, and when we sneeze or when we cough, we have to naturally close it,
Yeah.
because it should not spread to the other person.
I have
It
seen
should
this
not reach.
one point in WHO website, sir.
Yeah.
You can use the closed elbow like while sneezing and all.
That's a good gesture from them.
So
Definitely.
this is really nice. Closing the elbow when you are sneezing and all, you can use this elbow.
Definitely,
So that's
because
good.
it does not spread to the other person.
Yeah, we can't use our hands. So
Yes.
that's also one important point I missed.
And we have to avoid the airline travel, air travel, at least for some time.
Yeah.
We have to postpone all our foreign trips at least for some time. Then even in the domestic travel also, we need to take all the precautionary measures while traveling, because virus is very subtle, dangerous, tricky, devious. It can come in any form, attack us in any way. It can reside in us, and it can take any shape. And most important thing is, it can get adapted to our medicines very quickly.
Oh.
So we have to change the course of the treatment also very quickly. Otherwise we cannot catch it and hold it and arrest it and totally remove it from our body. So all these things have to be there. And as I have mentioned already, apart from the physical treatment, the most important element is the psychological or the mental training.
Yeah.
Psychotherapy has to be given, psychological counseling has to be promoted amongst the patients, because already they are facing a kind of aloofness, loneliness. They are kept in a separate ward or cell or in an isolated place. So mental trauma will be there. To get out of the trauma, we have to give psychological counseling. This trauma will be erased or depleted only through that psychological counseling. So physical and psychological integrated treatment has to be given, and along with that, if possible, our Indian system of medicine is always there to develop the whatever deficiencies are there, it can counter that, and our immune system will be really strengthened to counter any kind of viral attack. So all these precautions have to be taken very strictly, at least till this epidemic lasts, so that we all can wake up to a very good world with all happiness, brightness on our face once again.
Yes.
Very good.
So we conclude this show with all these important points. Dear viewers, please watch this and regain all the important precautionary measures what specified by Sudhakar Sharma. And if the people are watching, please do put a word to the people who don't know. Thank you very much. Keep watching CVR English. Thank you so much.